Good afternoon. This is the Joint Public Safety Committee meeting. Today is October the 8th. The current time is 1:03. Our first item of business is to review and approve the minutes of September the 24th. If there are no additional or corrections to the minutes, we will entertain a motion to approve as written.
I think we might need to, I don't know exactly how we need to send it back to Ms. Rhonda.
Is it for September the 24th or the 10th?
For September 24th. September 24th?
These are for the approved for the minutes for September the 24th.
I'm trying to make sure. Say September 10th right there. Say
Now, I wasn't here on the 24th. So the 24th.
I move for approval.
All in favor? All right, that motion passes. Detective Fikes, could you call up the first item for me, please?
Yes, Madam Chair, the first item will be Avondale Mini Mart, 4120 Messer Airport Highway, Suite A, Birmingham, Alabama, 35222. Mr. Narsimha.
Is the applicant here? Could you come to the podium and state your name and address for the record? Come up, sir. Hi. Hello. State your name and address for the record, please.
Sorry?
State your name and address for the record, please.
Yeah, Narsimha LLC. This is for transfer. My name is Sudhir Gadam and 4120 Mrs. Airport Highway,
Okay.
Birmingham.
All right.
535222.
Thank
Zip
you.
code.
Okay, Detective Fikes, are there any incidents at this location?
No incidents at this location, ma'am.
Okay, Ms. Brown, are they in good standing with taxes and revenue?
Yes, they're in good standing with taxes and revenue.
And Mr. Lowe, does the applicant meet zoning?
Yes, they meet zoning requirements.
Okay, this is the Avondale Mini Mart located at
Yes.
4120 Messer Airport Highway, Suite A. This is for beer off premises, wine off premises. The applicant met with the Neighborhood Association, and I do not see the date that he met. But the neighborhood, 10 were in attendance, 1 opposed, and 9 support. Does any counselors have any questions for the applicant?
No, Madam Chair. I move for approval.
All right, second, all in favor?
Aye.
All right, sir, that item passes the council agenda, and my staff will be in touch with you when you need to come to the full council for a vote. Thank you.
Thank you very much. Thank you.
All right, Detective Fikes, can you call up the next item for me, please?
Yes, Madam Chair, the next item will be Hot Shot Package Store, 306 Palisades Boulevard, Birmingham, Alabama, 35209. Mr. Bashir Omar.
Okay, applicant, can you come to the podium and state your name and address for the record, please?
Hello, my name is Bashir Omar.
Can you pull the mic down for me, sir? Pull the mic down, okay?
Okay. My name is Bashir Omar. The address is 306 Boulevard, Birmingham, Alabama, 35209.
Okay. Detective Fikes, any incidents at this location?
No incidents, ma'am.
Okay, Ms. Brown, are they in good standing with taxes and revenue?
Yes, they're in good standing with taxes and revenue.
And Mr. Lowe, does the applicant meet zoning requirements?
Yes, they do meet zoning requirements.
Okay, is there anyone here from the public to speak for or against this item? Okay, the applicant presented to the Glen Iris neighborhood on January the 8th. 19 were in attendance, 16 supported, and 3 abstentions. Counselor Moore, do you have questions for the applicant?
I move for approval.
Second, all in favor?
Aye.
Aye. Okay, sir, that item passes the council agenda. My staff will be in touch with you to let you know when it'll go to the full council for a vote.
Thank you so much.
Thank you. Detective Fikes, can you call up the next item for me, please?
Yes, Madam Chair, the next item will be Eastside Lounge, 4110 Airport Highway, Birmingham, Alabama, 35222. Mrs. Tanya Ansley.
Okay, ma'am, can you state your name and address for the record, please?
My name is Tanya Ansley, 41, excuse me, 4110 Mercer Airport Highway.
Okay. Detective Fikes, any incidents at this location?
No incidents at this location, ma'am.
Ms. Brown, does the applicant meet, I'm sorry, Mr. Lowe, does the applicant meet zoning?
Yes, she meets zoning requirements.
Okay, are they in good standing with taxes and revenue, Ms. Brown?
Yes, they're in good standing with taxes and revenue.
Okay, the applicant met with the North Avondale neighborhood on September the 19th, 2024. 12 was in attendance, 8 supported, and 4 with no recommendations. This is the application for a lounge retail liquor class 1. I've had an opportunity to review your safety plan. Councilor Moore, do you have questions for the applicant?
What was the capacity for yours? Oh, never mind, I see it right here, 99.
Can I say something? I critiqued it and made it 30. I didn't know if I posted, emailed it back to you, Ms. Tate. I got dry cough today. I'm sorry, y'all. Understand me. But I changed my age limit to 30.
Okay, can you
And
just,
this is the updated one.
Okay.
If you need it.
we need,
And also what I had to do, to be honest with you all, I had to put more lighting out there. And I had to put extra signs out there. Because that's the only way the police officer told me they'd be able to control the parking lot if I had the signs up.
okay, you have your updated, safety plan.
Yes, ma'am.
Can you give that to Sergeant Knight for us? And
Yes,
we'll
ma'am.
put it on the record. And so the age limit is what, it's 30?
Yes, ma'am.
And you put in extra lighting and extra signage?
Yes, ma'am.
Okay, have you thought about connecting your cameras to connect the real-time crime center?
Yes, ma'am. And also, if anything goes on in the parking lot or in the projects, they always come in, the detective, and I download anything they need. I never gave them an issue of no, of anything happening around the area or in the, where my building at.
Okay, and if you're interested in the connect, I would suggest that you get with Sergeant Knight or Detective Langford or Officer Fikes to provide you that information.
Okay, yes,
Okay.
ma'am.
All right, Councilor Moore, questions?
No questions, I move for approval.
Second, all in favor?
All right.
All right, that item passes, and my staff will be in touch with you to let you know when it goes to the council agenda for a vote.
Thank you so much.
Thank you. Yes, ma'am. The next item is item number 6. And that is,
6 or 4?
4? Sorry, 4. Oh, that's Mr. Lucian Blankenship. And you call up the next item. Come on, Mr. Blankenship. It's items 4 and 5, correct?
No, mine is number 6. When you said 6, I jumped up. I apologize.
You're 6.
I'll
So who? Okay, 6. It's for your,
Yeah, this is for
Magic City Classic?
Yes, ma'am. The annual Magic City Classic President's Reception and outdoor concert in front of Jazz's on 3rd.
Okay. Any incidents, Detective Fikes?
No incidents.
Are they in zone? What about zoning? Does the
They meet
applicant-
zoning requirements.
Okay. Ms. Brown, they in good standing with taxes and revenue?
Yes, they're in good standing with taxes and revenue.
All righty, got questions for Ms. Attorney Blankenship, Councilman?
No, ma'am, Madam Chair, I move for approval.
Second, all in favor?
All right.
All right.
Thank you.
Mr. Blankenship.
Appreciate
We'll
y'all
be in
taking the time.
touch.
All right.
Thank you. So items 4 and 5, OLB Enterprise, is the applicant here? Can you come to the podium and state your name and address for the record, please? Where is?
My name is Beverly Russell. You want the crossplex number, address first? Okay. It is, they put my address on here. This is my home address.
3081?
Yes.
Okay.
That's not crossplex, but I'm here for the crossplex.
Okay, can you tell us, you applying for a special retail liquor over 30 days. Can you go into some detail for each one of these events?
Yes, I am the new concessionaire for both locations. So I'll be handling all the concessions as well as the liquor and non-alcoholic beverages there.
Okay. All right, any incidents, Detective Fox?
No incidents, ma'am.
And Ms. Brown, are they in good standing with taxes and revenue?
Yes, they're in good standing with taxes and revenue.
All right, Mr. Lowe, meet zoning, do the applicant meet zoning?
Yes, they do meet zoning.
All right, Councilor Moore, do you have questions for the applicant?
No, ma'am. I move for approval on both items.
Second, all in favor?
Aye.
All right, that item passes, and my staff will be in touch with you and let you know when it goes to the council agenda for a vote.
Thank you all.
Thank you very much. All right, the next item is an ordinance. Is this Chief Moon? Chief Moon is an ordinance, a resolution pursuant to subsection 11-40-1, subsection 11-43-140, subsection 41-16-51A16 of the Code of Alabama 1975, authorizing the mayor to execute and deliver a purchase agreement for a period of not more than 1 year with LexiPool LLC for reference manuals and an annual subscription to fire policy subscription services used by the fire department, with the city paying the amount not to exceed $31,150.23. Said funds to come from GL 001-02201 1600160009.52705 professional service. Chief Moon.
Good afternoon, everyone. I'm Corey Moon. I serve as the Fire Chief of Birmingham Fire Rescue Service. And this item before you is a renewal of our policy management and policy training platform for LexiPoll. The annual cost is $31,150.23. This is something that we've had in place for going on about almost four years.
Okay. All right, Councilor Moore, you have questions for Chief Moon?
No, ma'am. I move for approval.
Second, all in favor?
Aye.
All right, that item passes, Chief Moon. Thank you.
Thank you.
Thank you. All right, old business and new business is community safety updates from someone from the mayor's office is here, and that would be Ms. Uche Bean and her team. And if you can come to the podium, Ms. Bean, and introduce yourself and your team to us and give us an update on the community safety initiatives.
Yes, ma'am. Good afternoon, Madam Chair and members of the Public Safety Committee, as well as members of the council. My name is Uche Bean. I serve as the Director of Community Safety Initiatives, and my team is behind me. Just wanted to introduce them as well. We have Devin Tanksley, who serves as the Program Analyst, Don Mosley, who serves as the Project Oversight Manager. Also, in the Division of Social Justice and Racial Equity, we have Chad Freeman, who serves as the Coordinator of Community and Strategic Engagement, and then a new team member here, Alita Wyatt, who serves as our Data Analyst. So just wanted to welcome my new team members and, of course, any additional team members that you might have met before. So, again, good afternoon. And today we just wanted to present an overview of what we are considering, what Mayor Woodfin spoke about earlier, which is an immediate response to the violence that we're seeing. And in an effort to reduce gun violence in Birmingham, we would like to use evidence-based trauma-informed methods, and we focus on those most at risk. You all have the document, the council members in front of you. And so we would be doing this by using a public health approach, utilizing community-led efforts and community-based organizations to move these programs forward, using holistic community engagement, and supporting those at-risk individuals. We're looking at a multifaceted approach to reducing gun violence and addressing the root causes of the gun violence and the underlying cause of violence. And in cities that have pushed these types of programs forward, we've seen places, and I can give you just some examples, places like Oakland, California, they've seen a 50% reduce in violence. New York, 63%, Baltimore, Maryland, currently at 56% reduce of both fatal and non-fatal gun violence. Los Angeles, California, 34%. Richmond, California, 66%. Newark, New Jersey, 60%. And within the first 4 years, overall, they saw a 30% decrease in overall fatal and non-fatal shootings. And so the purpose of this collaborative effort is to really focus on immediately reducing gun violence by focusing on those most at risk and utilizing community resources to do so. And so that would include victim services, as Mayor mentioned to you, expanding our hospital violence intervention program, which is currently in UAB trauma, expanding it to our ER, which means that we would have people based in the UAB ER, engaging with those that are victims of gun violence instead of them being treated and streeted, as they say, engaging them as a point of contact and letting them know the resources that are available to them. We would also set criteria for those people to be on call if need be in crisis situations. In addition to that, of course, intervention. That would mean having people on the streets of Birmingham, utilizing outreach workers and violence interrupters who will be vetted by a community hiring board, and this includes community leaders, faith-based leaders, and community organizations. They will be in the community working non-traditional hours and being planted in their respective communities, and they will be credible messengers in those communities. In addition to that, we've engaged an organization to implement a group violence reduction strategy, utilizing detailed data and records to conduct a gun violence problem analysis that examines both fatal and non-fatal shootings within the police department in Birmingham to focus on interventions on the population that is very at risk of being involved in shootings. And they do that over 30 days to 12 months to look at trends and provide supplement to law enforcement efforts. In addition, again, victim services, making sure that we have teams on the ground during crisis response and conducting high-risk case management and to be on the scene with active resources after gun violence incidents. In addition to engaging the community on a high level, we want to implement organized efforts that focus on using people that are justice impacted and those with lived experiences to aid in the movement of reducing violence, building political power, and organizing advocacy while also paying them to do the work in our community. And overall, in the end of this, we will be provided training and technical support from organizations that have done this work and been able to prove that this works. And we'll be managing the data to make sure that we can continue to improve the efforts that we are looking at, as well as make any type of changes that we need to make. Let me see. Can we give this to council? I've also provided an overall possible budget. This is not in stone. This is just what we're looking at as far as going forward with this proposal. So, and Councilor Alexander, I've provided you a document as well. Yes, ma'am.
That the update?
Yes, ma'am.
All right. All right, any questions for Director Bean?
Yes, I did. So the goal with the Community Safety Initiative is pretty much just to engage people at every level of crisis or, even in those preventative spaces as well, right?
Yes, sir. We're looking at an overall comprehensive plan. So we obviously have reentry, we have prevention, we have mentorship programs, but we're looking at obviously victim response and elevating it to another level, as well as intervening with people that are high at risk. So we can't just do one thing. We're looking at it overall as a complement to our law enforcement.
Got you. And I don't know if you might have information or the data on hand now, the victim services emergency room expansion piece. Let me see, because that's what we're doing in the UAB ER. Do you know how, successful that has been,
Yes, absolutely. I can give you the numbers as of to date. When the program first started, they had 42 clients enrolled. The goal was 60. And then year 2, they had 78. So since the kickoff of the program on February 14th of 2023, 120 clients have been enrolled. And of those, 86 are active. And the most important part of the data is what I'll share now, is that 98% have received no new injuries from gun violence. And that's really important because what we were finding was within 6 to 12 months, those people were being re-injured after going into UAB ER or the trauma unit. In addition to that, 0 of those clients have been killed by gun violence. Those were the non-fatal ones that entered into UAB trauma, and UAB medical staff saved their lives. And there have been 0 retaliatory shootings and 0 incarceration. So it's been extremely successful. And so our goal is to expand that into the ER and make important touch points that can continue to reduce retaliation.
I know that we have well, first of all, that's really good. And I'm glad to see that, that portion of the program is successful and effective. I'm curious as to whether or not, those individuals who denied, being a part of the program, if we have any data on them in terms of, like, these folks, did not want to be a part of the program, but we've seen them come back to the ER.
And I think that's the goal with our expansion. Unfortunately, I do not have that data. I can definitely check into that for you and see if our organization that we partner with has that. But that is really the goal, is that if they, let's say, for example, did go to UAB trauma within however long, ended back up in the ER, we would now be able to connect some really important dots.
Gotcha. Thank you.
Yes, sir.
Thank you, Madam Chairwoman. So with this proposal to continue the Javi program, will this expand to other hospitals?
I mean, in the dream of dreams, yes, ma'am. But at this moment, we are now currently partnered with UAB.
How much would it cost to expand to at least Princeton, for example?
I don't have the exact cost, but it is a pretty penny. And so we wanted to at least pilot it at UAB ER and see how that worked there. The goal would be, though, to expand to all interactions with folks in our community that are victims of gun violence.
And the pilot for just the ER for UAB is just 1 year?
Yes, and so I budgeted for 1 year, but the goal would be to keep it going. And the goal would also be to, as I mentioned in previous meetings, to look at our philanthropic community as well as our other partners that have financial resources to help support this work.
Okay, because I want to make sure, because this is super important, because honestly, with gun violence, it really starts with the victim as soon as they get shot, and you only have a certain short amount of time to really care for the person, and sometimes people don't always go to UAB. They have different hospitals they like to go to. I don't know if we're missing out on people, especially on the west side with 6, 7, 8, 9, 5, by not having Princeton in there.
Yes, ma'am. What I will say is I agree with you, but I also know that UAB takes in a lot. It is our Trauma One Center here, and so they see a lot of those victims, both city and county-wide, so I think that they're a really good population to begin with.
Okay.
Yes, ma'am.
Yes, sir. And the street outreach team, I think we had talked about, like, the different areas of the city. Do you guys know how many areas of the city would the street outreach team touch?
Our goal is to pilot in what we would consider high-risk areas or the most violent areas, but not just the most violent areas, but areas that can help provide resources to the community overall. The focus is community stabilization. So we would get the data, which we have, and we would focus in on those areas and launch it there. And then the goal, of course, would be to expand.
Okay. And I think that's it. Madam Chairwoman, I'm really excited to see this. I know you've been working hard on this, and, majority of the council, we've been supporting you, and I'm glad to see this work finally come into fruition. When will this come before the council?
I think we have one more step, which is budget and finance, to hammer out a budget that can work for the city, and then really based on you all. Yes, ma'am.
Okay. And I want to thank leadership as well for being open to listening to this and pushing this forward as well. So I'm excited that we're finally taking a holistic view to public safety. Thank you.
Yes, ma'am. Thank you.
Thank you, Councilwoman Smitherman. And I just want to echo the importance of why, Council Smitherman talked about the expansion, and we've had multiple conversations is injecting the emergency room into this, because we know that the non-fatal shootings, that wasn't being captured. And so Council Smitherman said something super important, is the first 24 hours is the most important hour. So getting this expansion and having the individuals being a part of the UAB emergency room and, being there when it happens and then being on call, that is super important. So excited to see, much of this coming to fruition. This took a lot of traveling, going to Newark, getting on the calls, talking to Shantae Jackson, who now works for Nick Jr., and seeing the reduction that cities bigger than Alabama, Birmingham, having, gun violence reduction. So I'm excited about, what we learn, just being in these cities in real time, going to the different partners that they had in the ecosystem to see how all of this mesh and works in real time. So it cannot be done. This is a complementary to policing, and it can't be done. And let me say this for the record and for those here in the listening audience, the community has to play a major role in this. Community safety means just what it means, community safety. You have to be engaged in making your community safe. And so, again, I want to thank you for the hard work. You hit the ground running, and you didn't stop until you got a robust plan into place with listening and going on these visits along, with me as well. So, again, thank you for your hard work, and thank you and your team members that's back there, Don and Devin. I know they put a lot of work into this, and you put a lot of thought into this. So again, thank you for what you've done since being in this role.
Thank you, Madam Chair.
Pro Tem, do you have questions for Director Bean?
Well, yes, I do. Thank you very much. Thank you, Madam Chair. I am excited about the program and the expansion because as being part of the 54% of people that the mayor mentioned this morning, where you've had a family member that's been a victim of crime related to gun violence. That's very important to me. I did want to ask, because we did not have this in 2020 when it happened in my family, but the emergency room expansion, I do like the fact, because we were sitting there over a period of time, and so we didn't have this as something useful, and it could help not only the victim, who is my son, but the family, and then, being in that situation. So I just wanted to ask, I am very hopeful that the results of this will show that we can expand that at least into one more hospital. And I'm not here saying for Baptist, Princeton, or whatever, but I just think, we have so many, again, you don't decide what hospital you go to when their paramedics are making that type of decision. So I would hope that maybe one day we wouldn't even need this, but I would hope as we go forward. So I did want to ask about the cost involved. This morning I thought the mayor had said to propose 1.5 million. So it is 2 million, and I apologize for being late. Have you discussed that already, of what that difference in the amount is, or is that,
No, ma'am.
that is the number?
It's 1.5. There's just additional reallocated money that we've already secured.
We've already approved?
Yes,
and-
ma'am. And there's a notation up here. It's just to reallocate it.
Okay,
Yes,
thank
ma'am.
you. Thank you very much.
Yes, ma'am,
Thank you.
absolutely.
Thank you, Madam Pro Tem. President, do you have questions for Director Bean?
No, I really just want to say, thank you for staying the course and continuing to push on this. I mean, that's to my colleagues too. I think this is something, that we've been thinking about for a long time and advocating for. So, just really glad to be in a position to support a significant expansion of our, non-traditional approach to reducing gun violence. So super happy to see this.
Mr. President, well, thank each and every one of you all for being thought partners and, being receptive and many meetings and listening to what we need to be doing to move Birmingham in a safe manner. We didn't get here overnight. We certainly are not going to get out of this overnight. It is going to take time. It's going to take collaboration and a collective effort and partnership, and with the partners that are out there, reentry, just an array of services that we really need to be offering, our people that want to come out of these lifestyles that they're in. But let me just be clear that those, you can put it out there, but those that don't want to take these, your actions and your decisions are going to bring about some great consequences. So again, excited about this. And again, thank you for the hard work that you have really, really did a deep dive into this, and it took a lot of conversations, but we're here nevertheless. And again, I want to thank Mayor Woodfin for, making this happen, because without the finances to get this pilot going, we would certainly not be here. But again, my colleagues, thank you all so much for, embracing. And I know Council Smithman, you had already been on this journey prior to me taking, the seat as the councilwoman. But again, thank you for the hard work that you, started out on this journey, and to see your vision come to fruition. Thank you all. Any questions for Ms. Bean? Any more questions? Go ahead, Mr. President.
Yeah, so I think this goes without saying, but I'm going to say it anyway. One of the things that I know this council will want to see is, robust data on the front end to, get sort of the baseline, and then, throughout the project period. And I know whatever setting we decide is appropriate, but even just written communication on a regular basis about the impacts would be helpful. I mean, this is something that our constituents are very engaged in, and each of us finds ourselves in a community meeting several times a week, oftentimes, and this is information that I know constituents appreciate. So getting regular updates on our progress would be most appreciated, so that we can use those settings to tell people what kind of progress we're making.
Yes, sir. Absolutely.
Mm-hmm.
And thank you, Madam Chair. And to that point, I got to be honest. Like, I wasn't a big fan, and you know this because we've had conversations, but wasn't a big fan of the whole ER intervention because, in my opinion, I just felt like there's better ways to engage to prevent people even having to end up in that position. And just not wanting to have bodies have to be shot up before they receive help, right? That was the heart of my concern. But people lie, numbers don't. And, based on the numbers that you've shared, it shows how effective it is. And even though that's a hard road to help, if it gets you to help, then it's the best plan forward. And so I do want to commend you and your team for the work that you all are doing, as well as, Council Tate and everybody else, who's really been, involved and pushing this forward from the beginning. Yeah, my kudos to all of y'all.
Thank you, sir.
I mean, it's just an update, right? Ain't nothing to approve.
No.
Yeah. Well, look.
Thank you. Thank you, Uche, for the update. Any more new and old business?
Thank y'all so much.
Thank you.
I move for adjournment.
All in favor?
Aye.
Second, all in favor?
Aye.
Thank y'all. Appreciate you.